Hello and welcome to Virtual Medicine 22. I'm Brennan Spiegel. I'm the director of our virtual medicine program here at Cedars-Sinai in Los Angeles. And on behalf of our entire vMed team, we're absolutely thrilled and delighted that you're with us for this dynamic and exciting two-day event as we explore the present and the future of medical extended reality, or MXR. Now, we started vMed back in 2018 at a time when XR was really just gaining traction in clinical practice. Now, of course, XR technologies had been around long before vMed and had been studied in elite psychology laboratories all around the world for decades. But around 2018, things began to change, in medicine at least, as XR began to find its way into the clinical trenches. Now, that's when we created vMed. We viewed the conference as a way to convene the brightest minds in MXR and to involve patients whose voice is absolutely vital to charting the future of medical extended reality. And also, we wanted to advance the science of MXR through multidisciplinary research. With generous support from the Mark and Sherry Rappaport Fund for Digital Health Science and Precision Health here at Cedars-Sinai, we launched vMed as a two-day symposium to great success. Now, after a hiatus due to COVID, vMed is back. We're stronger than ever. We're so happy to see hundreds of registrants this year from all around the world. This year's registrants include doctors and nurses and patients, tech investors, students, academic VR researchers, hospital administrators, and a wide variety of people from throughout the XR ecosystem, both in healthcare and beyond. Now, we've put together an amazing lineup of nearly 60 speakers representing the entire breadth and depth of the medical extended reality ecosystem. We're going to hear talks covering most every application of XR in healthcare, from using XR for pain management to surgical training to ICU care. We're going to also talk about the regulatory landscape and payer perspectives, and hear from top experts who are going to discuss the do's and the don'ts for creating and validating new MXR therapeutics. So check out the agenda for all the talks during our two-day vMed symposium. For those who are registered, the talks are going to remain available online for 12 months to you. You'll be able to access them anytime. And during the event, importantly, we're going to be running live chats that are moderated by our vMed staff along with other invited experts. So be sure to engage early and often on the chat to get the most out of the vMed platform, which is powered by our partners at Notified, who make Hub, which is the dynamic conference software that we're using for vMed22. Thanks so much for your support of vMed. This is truly a labor of love for our team, and we've worked very hard to bring you the best program that we can possibly imagine. Thanks also to our sponsors for helping us to make vMed a reality. We especially want to thank Applied VR, HP, and Northwestern Mutual for their major sponsorship of this year's program, and to all the other companies for their generous support. Be sure to check them all out in our exhibit hall and online to see the latest and the greatest that MXR has to offer. So thank you again for your interest in virtual medicine. We hope you enjoy the conference.